lab book reminders in Welford chart notes. In this video, we'll learn about what is a lab book reminder, creating lab book reminders, responding to lab book reminders, and redisplaying lab book reminders. Part 1. What is a lab book reminder? So let's try out this scenario. Suppose you found that your patient has an elevated bilirubin level. Your next step in the workup is to order a direct bilirubin. If the direct bilirubin is elevated, it suggests the patient has a hepatobiliary problem, and you want to be reminded to order an ultrasound. But if the direct bilirubin is normal, it suggests the patient has hemolysis or Gilbert's syndrome, and you want to be reminded to order different tests for that. At the time you order the direct bilirubin, you know what you intend to do later, but you want to remind yourself so you don't just ignore a normal result and think the workup is over when the test comes back. Lab book reminders remind you to perform a particular action when a lab test comes back with a particular value for a particular patient. This allows you to provide better quality care to your patients. Let's see this in action. Part 2. Creating lab book reminders. There are several ways to record a new lab book reminder. You can press Tools, Lab Book Reminders, Add. You can open Lab Book Reminders using its toolbar button, and you can open Lab Book Reminders Add using its toolbar button. When adding a new lab book reminder, first enter the name of the test that is going to trigger the reminder. As you start to type, the program shows you the names of tests in the lab book vocabulary that begin with those letters. You can then select the name of the test you want from the drop-down list. Enter the name of the patient to whom this reminder applies. Choose the condition for this test for which the reminder applies. In this example, direct bilirubin is a numeric test. Thus, you can have the reminder triggered if its value is above or below a certain number. For example, we can have the program trigger the reminder if the direct bilirubin is greater than 1.5. You can choose a condition of normal if you want the reminder to be triggered whenever the abnormal flag for this test is stored in the lab book as normal. You can choose a condition of abnormal if you want the reminder to be triggered whenever the abnormal flag for this test is set to anything besides normal. Lastly, you can choose no condition, which means that this reminder will be triggered the next time this patient has this test stored in the lab book, regardless of the value of the test or its abnormal flag. If you choose one of the numeric comparisons for the condition, specify the value above or below which the test should be in order to trigger the reminder. The program automatically looks up and fills in the units for the test you have specified. Note that if the test is not numeric, such as a chest X-ray, then the available conditions only include normal, abnormal, and no condition, since it does not make sense to compare a non-numeric test to a value. In the reminder box, type in the test or activity you want to be reminded to do if this patient has this test meeting this condition. In this example, we want to be reminded to order an ultrasound. You can also enter an optional comment, for example, explaining why this reminder is important, such as likely hepatobiliary disease. Press OK to store this reminder. You can have more than one reminder for a particular test and patient. For example, we will create another reminder now, which is triggered if the direct bilirubin is less than 1.5. Part 3. Responding to lab book reminders. Now let's record the fact that Kelly Erickson has a direct bilirubin result coming back to the lab book. Remember that this might be days or weeks after the time when you originally ordered it, by which time you may have forgotten what you intended to order next depending on how this test came out. Let's record that a direct bilirubin has a normal result of 0.5. Notice that the lab book reminder for this patient for direct bilirubin less than 1.5 is triggered, reminding us to order haptoglobin and LDH because the most likely diagnoses are hemolysis or Gilbert's syndrome. You can now press the jump button to move to a different part of the chart. For example, you might decide to send a message to your secretary to inform the patient of the next steps. Or you can press Orders and order the haptoglobin and LDH for this patient. You can press the Info button to see who recorded this lab book reminder and when they did so. Notice that once the lab book reminder for this test and patient has been triggered, if we subsequently enter a result for this test and patient with this condition, the reminder is not triggered again. The program assumes that you have taken care of whatever needs to be performed after you see the reminder the first time. Part 4. Redisplaying lab book reminders. You can easily see what lab book reminders are recorded today by pressing Tools, Lab Book Reminders. Click Add to add a new lab book reminder. Click Delete to erase the currently highlighted lab book reminder. Double-click a lab book reminder or highlight it and press Edit if you wish to change it. Highlight a reminder and click Info in order to see who recorded the reminder, when it was recorded, and whether it has been triggered, in which case how it was handled. Notice that the first reminder has a handled status of not applicable because it is only to be triggered if the direct bilirubin is greater than 1.5, whereas in fact it turned out to be less than 1.5. On the other hand, the second reminder has a handled status of handled because it was in fact displayed to the user Beverly McFadden at 7:47 p.m. Click the Redisplay button if you wish to see a different section of the lab book reminder database. Enter the start date for the earliest date you wish to see. If you want to see all entries after that date, click the After button. Click the End date for the most recent date you wish to see. If you wish to see all entries before that date, press the Before button. If you wish to see all of the dates in the database, click the All Dates button. Specify the name of the patient or press the Any button if you wish to see all of the patients in the practice. Specify one or more handled types or press All to see all of them or None to see none of them. Of course, you must check at least one of them or there would be nothing to redisplay. Checking none of them redisplays as if all of them were checked. You can optionally enter some text, and the program will limit the redisplay to those reminders which contain that text somewhere within them. Check the Show Deleted button if you want to see even deleted lab book reminders. Click the Calendar button if you want to use the program's calendar to specify the start date or end date. In this example, we are going to redisplay all of the reminders from today except the ones that were handled. Click OK to redisplay the lab book reminders using our new settings. And that's how to use lab book reminders in Welford Chart Notes. For more information, visit us at emirj.com.